is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/newwebreg2021 here and abroad. Registration is free and open to physicians and concerns healthcare relating to the female, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at New Webinars, and YouTube at tinyurl.com/newwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram. Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila. The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/mewwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mew Webinars, and YouTube at tinyurl.com/mewwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/mewwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mew Webinars, and YouTube at tinyurl.com/mewwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram. Good morning to everyone. Welcome to today's forum. The forum will start in 15 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/MuWebReg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/MuWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube, and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram. The forum will start in 5 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram.
Orasio Imperata para sa proteksyon laban sa COVID-19 virus. Mahabagin at mapagmahal na Ama, nagsusumamo kami sa iyo upang hilingin ang iyong patnubay laban sa COVID-19 na nagpapahirap sa marami at kumitil na ng mga buhay. Tunghayan mo kami ng may pagmamahal at ipagadya kami ng inyong mapaghilom na kamay mula sa takot sa kamatayan at karamdaman. Itaguyod mo kami sa pag-asa at patatagin sa pananampalataya. Gabayan mo ang mga dalubhasang naatasan na tumuklas ng mga lunas at paraan upang ihinto ang paglaganap nito. Nagpapasalamat kami sa mga bakunang naisulong sa patnubay ng iyong mga kamay. Pagpalain mo ang aming mga pagsisikap na mawakasan ng mga bakuna ang pandemya sa aming bayan. Patnubayan mo ang mga lumilingap sa may sakit upang ang kanilang pagkalinga ay malaki pa ng husay at malasakit. Pagkalooban mo sila ng kalusugan sa isip at katawan, katatagan sa kanilang paninindigang maglingkod at ipagsanggalang sa karamdaman. Itinataas namin ang mga nagdurusa. Makamtan nawa nila ang mabuting kalusugan. Lingapin mo rin ang mga kumakalinga sa kanila. Pagkamitin mo ng kapayapaang walang hanggan ang mga pumanaw na. Pagkalooban mo kami ng biyaya na magtulong-tulong tungo sa ikabubuti ng lahat. Pukawin sa amin ang pagmamalasakit sa mga nangangailangan. Sa pagdamay at malasakit namin sa bawat isa, malampasan nawa namin ang krisis na ito at lumago sa kabanalan at pagbabalik loob sa iyo. Hinihiling namin ito sa pamamagitan ni Hesukristo na nabubuhay at naghaharing kasama mo at ng Espiritu Santo, Diyos magpasawalang hanggan. Amen. Dumudulog kami sa iyong patnubay, mahal na Ina ng Diyos. Pakinggan mo ang aming mga kahilingan sa aming pangangailangan at ipag-adya mo kami sa lahat ng kasamaan, maluwalhati at pinagbalang Birhen. Amen. Mahal na Birhen, mapagpagaling sa may sakit, ipanalangin mo kami. San Jose, ipanalangin mo kami. San Rafael Arcangel, ipanalangin mo kami. San Roque, ipanalangin mo kami. San Lorenzo Ruiz, ipanalangin mo kami. San Pedro Calungsod, ipanalangin mo kami.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM live stream. The title of this forum is A Woman's Diet for Better Health or Ang Wastong Nutrisyon para sa Kababaihan. Today's forum aims to give us insights on the basics of nutrition and healthy meal planning and the importance of having proper nutrition to good health among pregnant and non-pregnant individuals. For today's forum, we have Dr. Anna York Bondoc, a pulmonary oncologist, surgical and medical intensive care physician, and a former congresswoman for Pampanga's 4th District as our moderator.
Hello and good morning po. Happy New Year sa inyong lahat. And thanks for joining us today. Our webinar po today is entitled The Woman's Diet for Better Health. And we will discuss po dito yung adequate nutrition and importance of nutrition and the proper diet po among pregnant and non-pregnant individuals. So makakapag-plan din po tayo ng mga meals. So please do join us. OB gynecologist and maternal and fetal medicine health specialist. Basically, si Sherri is also an internist and an endocrinologist. So everyone, we'll introduce first Sherri. She will be our first speaker. So alumni of H and her maternal and fetal medicine fellowship also in PGH. Right now, she is a clinical associate professor at UP Medicine, PGH, and she's also the head of the maternal and fetal medicine unit of the Manila Medical Center, Manila. So everyone, she's also, on a lighter note, Sherri is also known as a fashionista doctor and a dog lover. So let's welcome po Dr. Sherri Ann L. Suplido of Mu Sigma Phi Sorority Batch 2002. Sherri, are you ready?
Hi, Ma'am Anna. Thank you po for your kind introduction. Hello, everyone. I'll share my slides, Ma'am Anna.
Sure.
Okay. Thank you very much. So, Ma'am Anna, can I be heard clearly and are my slides visible po?
Okay, we can see it.
Thank you. So good afternoon, everyone. So my lecture for this afternoon is on optimizing nutrition for women in the reproductive age, but we will be focusing also on pregnant women and a little on the postpartum women, yung mga nanganak na. Okay, so the goal of every woman in her reproductive age is to be healthy. So bakit naman gusto natin maging healthy? Because majority would like to have a baby or try to conceive. And at the end of everything, of course, after the pregnancy, we want to have good health for both the mother and the baby. So how do we achieve that? We have to live a healthy life even prior to pregnancy. And how do we do that again? So we have to, apart from living healthy, we have to have the proper nutrition. So yung diet ng women of reproductive age. So pag sinabi mong women of reproductive age, that's between 15 years old to 49 years old. So nagva-vary minsan. Sabihin ng iba 50 or 51, but it depends. But in general, the WHO defines the reproductive age women from 15 years old to 49 years old. So generally, parehas lang naman yung diet ng babae in that age group compared to the general population. But when they become pregnant, when they're breastfeeding, the nutritional requirements will be different. So pwedeng may ibang mas konti, but generally, mas malaki yung requirement ng buntis at saka nagpapasuso. So kailangan we're very particular regarding that. Pag nandun sila sa mga periods in their lives wherein the nutritional requirements are increased. Okay, so in general, alam naman natin to, pero mahirap lang talaga siyang gawin, no? Simple carbohydrates are restricted. So siguro ang ano na lang dyan, the more na matamis at masarap kainin, yun yung bawal, no? Okay, but later on through this lecture, through my lecture and Ma'am Myrna's lecture, we will be able to know the proper diet, no, for women of all stages in their lives. So complex carbohydrates, hindi sila masyadong masarap. So yan yung mga legumes, seeds, starch, but generally mas mababa or they have a lower glycemic index. So, but in general, hindi din pwedeng overeat din tayo ng complex carbohydrates. So dapat din within reasonable quantities yung pagkain natin. So it's very good that you have good protein sources in your diet. So red meat, mamaya we will be discussing on iron requirements and anemia. So red meat, fish, poultry, pero may like in pregnancy, hindi din pwedeng lahat. Kasi some people think na pag puro fish, healthy siya. So mga pescatarian, tinry ko din yun before. But for pregnant, particularly for pregnant women, hindi din pwedeng lahat ng servings fish. So later on, we'll discuss that. So we have to have our protein supplemented with small amounts of butter and vegetable fats. So yung fat dapat yung good fat like the vegetable fats. So the typical woman, busy siya, basta babae siya, I'm sure. So whether housewife or she's at home taking care of the baby or she's a working mom, she needs to have the proper nutrients so that she'll have energy to fulfill all her duties, whether housewife or working mom. And plus, we want to protect ourselves from risks, mga hypertension, or risk for diabetes or obesity. So generally, so basically for this lecture, lalo na yung mga gustong magbuntis, matutulungan ko kayo because you'll be learning on which minerals or vitamins that you need to have to enter the pregnancy in a good state or in a healthy state. So sana iron rich yung food, rich in folic acid, or if ever you cannot get it from the diet, we have to have supplements, and we have our daily calcium and vitamin D requirements as well. So according to the Institute of Medicine, so women age, so reproductive age, 14 to 50 ang nila, so pwedeng 14 to 49 years old. Regardless of if that patient is pregnant, buntis siya, or she's breastfeeding, that woman needs 1 gram to 1 gram of calcium per day and around 600 international units of vitamin D. But you can get it from the diet kung magaling ka naman kumain ng calcium. So dairy and the eggs and everything, you can get the calcium. But if you are menopausal or postmenopausal, mahirap siya kunin from the diet. And the recommendation really is to for the prevention and treatment of osteoporotic fractures, may supplement talaga. So they have to have at least 1.2 grams of calcium per day and 600 international units of vitamin D. So until the age of 71. So para hindi sila magkaroon ng mga fractures related to osteoporosis because of their postmenopausal state. So having proper micronutrients is very critical during the reproductive years. Kasi pag may mga kulang, later on I'll really focus on that. It can have adverse effects. There's difficulty getting pregnant. If ever you get pregnant, pwedeng may effects on the baby if you are micronutrient deficient. So why do we become micronutrient deficient? Because of our diet. So poor dietary intake lang. So if you have deficiencies in calcium, iron, folate, zinc, so yung mga usual vitamin B, vitamins, they're very frequent and prevalent among the reproductive age women, particularly yung iron, yung problem talaga natin. And when we are deficient in the micronutrients, so particularly folic acid, we can have adverse pregnancy outcomes. Hindi maganda yung result ng pregnancy. So you can have neural tube defects. Later on, may mga, I'll show a picture of a baby having a neural tube defect, mga anencephaly, yung walang crown yung head, or early pregnancy losses, pwedeng spontaneous miscarriages, or even hypertensive complications in pregnancy like preeclampsia, and yung worst, syempre, maternal death or mortality. So let me discuss preconceptional care, introduce to you the concept of preconceptional care. So as OBGYNs or high-risk pregnancy specialists, we really push for preconceptional care. So these, according to the Center for Disease Control, these are a set of interventions that aim to identify and modify biomedical, behavioral, and social risks to a woman's health or pregnancy outcome through prevention and management, which means hindi maganda yung pupunta yung patient, buntis na siya, tapos sabihin, Doktora, minsan past the first trimester na, I'm pregnant, please take care of me. Better, yung iniisip pa lang niyang magbuntis, 6 months to a year before she contemplates or parang decides na she wants to get pregnant, dapat nagpunta na siya sa clinic. So ang maganda doon, ang benefits nun, you're able to screen for the patient for any medical conditions. If she's obese, she has to lose weight first. Kung dati siyang hypertensive and yung dating pregnancy niya, nag-preterm delivery siya because kailangan niyang ma-CS dahil mataas yung blood pressure, then we try to modify the adverse outcomes. Yung titry natin na, hypertensive talaga siya, i-control mo na yung blood pressure niya. Oo, so kung diabetes, i-control yung diabetes so that she'll enter the pregnancy in a healthy state. So, una, kung healthy siya before getting pregnant, mas madali for her to become pregnant. Kasi if you're obese, mahirap to become pregnant. And then, you enter the pregnancy, hindi ka diabetic, hindi ka hypertensive, plus yung outcomes for the baby. So there are studies saying also that for example, the body mass index o yung weight ng mother pre-pregnancy may effect long-term sa offspring. So yung mga dyslipidemic, yung matataas yung cholesterol, they're obese when they became pregnant, yung offspring nila later on when they go into adulthood may risk din. So 'di ba? Parang better na lang, kawawa naman yung baby. So better to optimize yourselves first before getting pregnant. And kaya 6 months to a year, kasi syempre if you have to lose weight, control the blood pressure and everything, hindi naman yun magagawa ng mabilis. So it's better na there's ample time. So there are many facets of preconceptional care, but for the purpose of this lecture, we will be focusing on the assessment of our patients or the woman's nutritional status. So I'm going to focus on nutritional anemia because it's one of the more prevalent nutritional deficiencies in our patients, women of reproductive age, and especially when they become pregnant. And the most common would be iron deficiency anemia. So prevalent yan among children also kasi nga, di ba, yung mga may hookworm infections, parasitic infections, but particularly for the reproductive age group and the pregnant and lactating mother, special group yan. So if you can see, very prevalent among children and mothers, and then the male counterpart, hindi sila masyadong affected by iron deficiency unless super mababa, hindi sila masyadong kumakain ng bioavailable iron. So tayo as women from the childhood and then adolescent and then pregnancy, lactation, we are at risk for iron deficiency anemia. It's a global burden. So you can have iron deficiency without anemia actually, and even iron deficiency hindi naman necessarily anemic. It can also have negative health effects on us as women even during the adolescent phase, no? So why are we iron deficient? Because we don't poor intake, no? Hindi talaga tayo maganda kumain, no? And ano ako dyan, guilty also of that. And or for example, for the adolescents, there is also a period of increased iron requirements. So yan talaga, so pagdadaanan talaga natin yun. Or as women, mahirap maging babae, there are many gynecologic problems that will cause bleeding. So vaginal bleeding, for example, myoma or endometriosis or any form of heavy menstrual bleeding, ayan, edi at risk na tayo. And then, kung magkaroon ka pa ng parasitic infection, like a heavy hookworm infection, more at risk ka. So I've mentioned that the adolescents, the girls, lugi na, no, pag-enter pa lang ng menarche when they had their periods, at risk na for iron deficiency because of the cyclic losses. So even if you just say na 80 cc lang naman per cycle ang loss, pero parang it doesn't feel like 80 cc, no? Blood loss pa din siya, cyclic, every month, every 28 days, no, on the average. So plus, if you're an adolescent, so you're starting to get your period, it's also accompanied by rapid growth and expansion of red cell mass, so may mga tissue requirements. So the adolescent female is more vulnerable to the male counterparts. Ganun din in the reproductive age group. So ito, guilty ako, no, as a gynecologist. Sometimes patient comes in for heavy menstrual bleeding. Nagagamot mo siya, you address the concern either medically or surgically, but sometimes you fail to restore yung blood lost, no? Parang pag hindi na siya maputla, wala na siyang symptoms, pero dapat i-maintain natin na the iron lost, the blood lost would be restored because may effects din yun, eh. Very occult, but it has effects on the patient's well-being. So the effects of IDA are very well emphasized and understood kasi obvious, no, parang sobra ka nanghihina, you're weak, you're irritable, you can have a lot of hair loss. Minsan kala mo bakit ka nag-hair loss, kala mo sa shampoo mo pala IDA ka pala. you cannot concentrate. O yan, di ba? Parang very occult yung mga symptoms pero effects of IDA na pala. Some would have unusual eating habits. So common to sa pregnant, no? Makain ng paper, ice chips yan, or that's called pica. But syempre, some would really require medical attention because they're suffering from high output failure talagang. They're dizzy, they're short of breath. Yan. But I've mentioned that there are effects of iron deficiency anemia, but there's also emerging evidence saying that even without the anemia, you can have negative consequences because of your iron deficiency. So yeah, we have to pay close attention to this. So yun nga, pagka siguro hindi ka blood donor or hindi ka naging pregnant or hindi ka lactating mother, minsan di mo mapapansin yung iron deficiency without anemia. But I guess if you are in a state wherein there is increased requirement, dun mo mafe-feel yung effects niya. Okay, so WHO, just for our knowledge, defines anemia for the reproductive age women less than 120. But if you notice in this slide, the threshold is lower sa buntis and then as they go into the postpartum period. But ang laging nakakalimutan ng obstetrician, you restore them back dapat dun sa pre-pregnant nila na hemoglobin. So because of that, the WHO has public health interventions. How do we improve our iron status? Like the Philippines is one of the more iron deficiency anemia is very prevalent. So how do we do that? Nutritional counseling, so like this lecture, yan, mga lay fora, fortification of staple or routinely consumed foods with iron. So if you're one of those people who yung mahilig ka tumingin sa nutritional facts, very conscious ka, you will see there, di ba, fortified with iron, kahit lahat na, fortified with iron, kahit mga junk food, fortified na siya with iron. And then, of course, you want to treat, and we do this, it's a public health program, treat preventable causes like hookworm infection. And if the need arises, you have to have the iron supplementation. So if you're between 15 to 49 years old and you're a woman, you're in your reproductive age, the recommended daily intake of iron is 18 milligrams per day with a median of 12 to combat the blood losses when you have your periods. It's slightly lower for men at 8 milligrams. And ang gusto natin kainin para ma-restore ang ating iron is to eat the bioavailable heme form. So that's very, these foods like red meat, poultry, fish, yan, rich in the bioavailable heme form. Yung hindi masyadong absorbable, pero rich in iron din. Whole grain cereals, legumes, yan. Oo, pero they're all rich in iron. Pero doon tayo sa gusto natin, yung high yield, so doon tayo sa bioavailable heme form. So, ito common question. So, because of that, and all this talk about need for iron, do we really need iron supplementation? So, in pregnancy, iba pa yun, ibang case yun. But what if you are in the reproductive age? So, do you need, nga, nag-mention ako na may blood losses cyclic, diba, for the menstruating women in the population. So, there's a systematic review by Cochrane on adolescent girls. So they've already had their periods and then they're in the reproductive age prior to menopause. They're not pregnant or lactating, so wala namang increased iron requirements. And they do not have any condition that impedes the presence of menstrual periods. So hindi din sila amenorrheic. So dito sa study nito, 12 to 50 years of age. So they randomized they divided the group into those taking daily iron supplementation with or without a co-intervention. Kasi sometimes you give vitamin C to add to the absorption, and then folic acid kasi kung it's a form of nutritional anemia. And then the other group didn't receive the iron, so either as a placebo form. And when you say daily supplementation, di naman daily na every day in a week, but at least 5 days for that week. So they found out in that study that menstruating women and adolescent girls who received the daily iron had a lower risk for the critical outcomes of anemia and iron deficiency, and then they had higher hemoglobin levels. So nakaigis sa kanila when they were taking the iron. And because of that, tapos side effects, very minimal. The usual is the gastrointestinal side effects. So because of that, the WHO made a guideline and as a program that women of reproductive age, menstruating women from adolescent and the reproductive age, they should have a daily iron supplementation, especially if they're living in an area wherein anemia is prevalent. So ibig sabihin 40% of that population ay anemic. So what does that mean? At least 30 to 60 milligrams of elemental iron. And usually naman whatever form that you have in the market, either gluconate, sulfate, fumarate, lahat sila, at least 60 milligrams meron siya. So bumili ka na any of that. And all those are also absorbable salt forms. So okay, you take it daily, 5 days in a week, but not naman the whole year, for 3 consecutive months in a year, to combat the iron deficiency because of the cyclic losses. Yeah. So let's go back to our patient. Let's say she wants to get pregnant. No? So what can we advise her? So eat a lot of fruits, vegetables, and then the daily multivitamin. Most of the minerals and vitamins kasi you can get from the diet if you're eating a well-balanced meal. But there are some na we will discuss later na kahit anong kain mo ng green and leafy vegetables at hindi mo ma-attain yung recommended daily allowances, for example, for iron or folate, that you really need a daily multivitamin. So that would assist you in your reproductive health, both for the husband and the patient, or the females. So later on, we will be discussing the benefits of pre-pregnancy folic acid supplementation. So that is sinasabi lang namin, if you want to get pregnant, take it a month prior to getting pregnant and up to the first trimester. So that's the first 14 weeks of the pregnancy. Take folic acid a day. But ang daming unwanted pregnancies or unplanned pregnancies. So the recommendation of CDC is for all reproductive age people, women, between 15 to 45 years old should take folic acid supplementation kasi hindi mo alam capable ka of getting pregnant but you don't know when. So better na lang, all those capable of getting pregnant in this age group, they should take the folic acid. So we usually give 400 micrograms a day, but if, for example, that patient had a prior pregnancy na mayroong neural tube defect, you have to increase the dose to 4 milligrams per day. Of course, apart from eating well and taking your supplement of folic acid, for those who want to get pregnant, they have to attain, sinabi ko na to kanina, a body mass index in the normal range before attempting pregnancy. Because kung overweight, obese, or low BMI, ang daming negative effects on fertility as well as maternal and fetal outcomes. So these are the different or the various reproductive risks of obesity. So una, mahirap magbuntis, no? So if you're obese, you're prone to a lot of hormonal imbalances, particularly, for example, polycystic ovarian syndrome. So you're anovulatory, hindi ka nangingitlog monthly. So ano na yon, risk na yon. And then if ever you became pregnant, so na swerte ka, kahit obese ka, nabuntis ka, you can have pregnancy losses as well. Birth defects, preterm birth, so all the comorbidities that can accompany pregnancy. You have gestational diabetes, hypertensive complications, and all these will increase your risk for operative deliveries like cesarean section, and even other adverse maternal outcomes like thromboembolic events. So better normal range of BMI before getting pregnant. Kaya important yung preconceptional counseling. You go to your OB 6 months to a year prior to getting pregnant. So sabi mo, Doc, I want to get pregnant on ganyan kunwari, in July next year. So ipaplan nyo na yun. Screen ka na ng doctor. Yun. So ideally, your weight should be optimized. You want to enter the pregnancy very healthy. If, for example, you're obese or marami pang kailangan gawin sa'yo, that the obstetrician will advise you to delay pregnancy, except lang kung factor din kasi yung age. Some are infertility couples and then they're also advanced maternal age. So minsan na-shorten period, but generally 6 months to a year in preconceptional counseling. So we don't want to be overweight or obese when we're pregnant, before getting pregnant, but also di din maganda yung sobrang payat, no? Because being underweight is associated with several risks like poor nutritional status, heart irregularities, osteoporosis, amenorrhea, and infertility. So they are also at risk for having, kung maliit yung frame ni mother, they are at risk also for having small for gestational age fetuses. Ayaw din natin ng maliit na baby. So minsan sasabihin ng patient, ayoko na masyadong malaking baby para maka-normal delivery ako. Okay naman yung thinking na gano'n. Basta okay yung weight ng mother and the weight of the baby is appropriate for age. Kasi may failure to thrive, mahirap din mag-thrive ang growth-restricted fetuses. So, ayaw din natin. So that's for the reproductive age woman before she gets pregnant. Let's say very successful, your preconceptional counseling, you're able to maintain a good weight, she was able to eat healthy, and then she's pregnant na. So if the patient was able to attain a normal weight, meron tayong weight recommendations depending on the pre-pregnancy body mass index. So, for example, normal weight siya, normal BMI. So, 25 to 35 pounds in the whole pregnancy. So, I tell the patients usually, or mga 12.5 kilos yan the whole pregnancy. You advise the patient to gain less when she's obese or overweight and gain more if she's underweight. So usually, I tell my patients, first trimester, so that's the first 14 weeks, 5 pounds and then 1 pound per week. Mahirap yun i-attain, to be fair. Konting patients lang yung kaya nila yung 25 to 35 pounds. Usually talaga lumalabas sila dyan. So it's the duty of the OBGYN to really counsel them well. So nutrition during pregnancy is very important because doon nakasalala yung good fetal and maternal outcomes depending on the nutritional status during pregnancy. So we have to have dietary counseling. You identify which of your patients need special attention. Kasi okay naman kung your patient is a normal patient, low risk, but if she has a comorbidity, she's diabetic, she has restricted dietary preferences, she's obese, then you might have to refer your patient to a dietitian or a nutritional specialist. Okay, so in terms of calories, there's really an increase in caloric intake by 100 to 300 kilocalories per day, and that's recommended during pregnancy. As the pregnancy progresses or the age of gestation increases, mataas yung caloric requirements. So up to 450, tapos more pa, minsan umaabot pa ng 600 plus, 640 kilocalories per day when the patient is breastfeeding. So, yan. For proteins, approximately 1 kilogram of protein are deposited. So she needs that, amounting to 5 to 6 grams per day. So to accomplish this, the protein intake should be 1 gram per kilogram per day recommended. So mapupunta yan sa fetal mass and the placenta. In terms of minerals, we get everything from the diet. So basta you eat a healthy diet. No need for supplements except for iron and iodine. Okay, so in terms of calcium naman, I mentioned, so in the reproductive age, di ba kailangan ng at least 1,000 milligrams of calcium and 600 international units of vitamin D, but we get it from the diet. During pregnancy, hindi mo rin kailangan ng special calcium unless you're in a population na mababa talaga yung baseline calcium. But we're starting to give calcium at around 1 to 1.5 grams per day with vitamin D for the prevention of hypertensive complications dun sa mga high risk. So may benefit yan sa kanila so that they won't have preeclampsia during the pregnancy. So in terms of iron, I've mentioned that the requirements are increased during pregnancy. Of the approximately 300 milligrams of iron transferred to the fetus and placenta, the 500 milligrams of iron is incorporated into the maternal hemoglobin mass. And it's used, all of it is used after mid-pregnancy. So if you notice, if you get the hemoglobin of a patient early on in the pregnancy, normal pa yan. But in the second trimester, with the iron requirements are increased, and there's also increase in plasma volume, parang may delusional or gestational anemia, talagang manonotice mo yung drop in the hemoglobin. So because of that, the AAP, or American Academy of Pediatrics, and ACOG, American College of OBGYNs, and we follow this, endorse the intake of 27 milligrams of elemental iron to be given as a supplement. No, because we cannot get yung iron natin from the daily diet. So we need to have an iron supplement for that. If your patient is obese or carrying twins or triplets, or she's pasaway siya, she didn't go into your clinic early during prenatal checkup, she began late for her supplementation, or she's taking it erratically, then you have to increase the iron to 60 to 100 milligrams per day. Although, I understand pa yung mga patients kasi may gastrointestinal effects din yung iron. Some would, most of them would complain of diarrhea, constipation, some diarrhea. So meron talagang upset. Kaya minsan hindi sila compliant. So you just have to adjust. You tell them to, although the best way to take iron is on an empty stomach, yung best absorption. But take it with vitamin C, or pag di ma-tolerate ng patient, you just tell her to take it with small amounts of food para compliant siya dun sa ating requirements. So you have to tell your patients of the benefits of, hindi lang iron deficiency kasi, there are many adverse maternal and perinatal outcomes associated with anemia during pregnancy. So if the patient is anemic and she's pregnant, these are the following fetal outcomes: low birth weight, preterm birth, small for gestational age, and the worst is stillbirth. And in the mother, she's at risk for hemorrhage, postpartum hemorrhage, and uterine atony, nag-bleed after manganak, hypertensive complications, and of course, syempre, kung mataas yung bleeding or there's postpartum hemorrhage, then there's an increase or there's a need for blood transfusion. As regards iodine, the RDA is 220 micrograms per day, but you don't need a separate supplement. Just use madami namang fortified with iodine. So you have iodized salt or bread products, but tingnan nyo, lahat yun may iodine na. So pwede na yan to offset all the requirements during pregnancy. So in terms of vitamins, so kung in minerals, iodine tsaka iron, kailangan hindi lang diet, no, may addition, supplement or yung fortified food. For vitamins, all the RDA are met in the diet except for folic acid. So bumalik na ulit, ayan na ulit si folic acid. So very important. Apart from the serious congenital anomalies of the brain, so ito yung picture ng anencephalic fetus or yung mga acrania, walang crown, yan, or yung mga may mga masses dito sa likod, o yung bukas yung dito nila or spina bifida. Those are the consequences of folic acid deficiency. So apart from that, although we do not take folic acid to avoid the following, no? Kasi mga lang to, small studies lang. But these studies have shown that there are also negative health outcomes during pregnancy. So you can have placental abruption or premature separation of the placenta, duduguin yung mother pag ganon. Hypertensive complications like preeclampsia, pregnancy losses, congenital heart defects, preterm birth, low birth weight. So ayaw natin nun. So it's better na preconceptional, we're already taking the folic acid until the first trimester of pregnancy. So because of that, like iron, the WHO came up with public health programs and guidelines. So we have to maintain our folic acid levels. And because of that, yun nga, I mentioned earlier, you have to take 400 micrograms of folic acid if you are between 15 to 49 years old, capable of getting pregnant, hindi lang planning to get pregnant, until the first trimester of pregnancy. And if you had a prior pregnancy with a neural tube defect, meron ng congenital defect prior, then you have to increase your folic acid to 4 milligrams per day. So as part of pragmatic surveillance for our patients, so during their prenatal checkup, we advise them to eat that type of food that is rich in certain nutrients in reasonable amounts, and ensure that food is amply available. May mga low resource tayong mga patients kasi. A part of the prenatal checkup is to monitor their weight gain. So make sure that they adhere sana to the 25 to 35 pounds if they're of normal BMI. Ito, medyo guilty ako dito as an OBGYN. Sometimes, dun lang ako particular sa gestational diabetic patients or hypertensive patients, yung talagang iniisa-isa ko yung diet nila. But yung mga normal, pag normal yung weight, tapos normal naman siya, sometimes we forget to explore food intake by dietary recall. Yan nyo lang, o kamusta naman yung diet, ano kinakain mo, ilang ganito, from time to time, so that you would know whether they're having an erratic diet. And then, of course, for those minerals and vitamins na you cannot get from the diet, you have to supplement it, like the iron salts, at least 27 milligrams, the folic acid, especially in the first trimester of pregnancy and even prior, and then the iodine through the fortified bread and food products. And then we usually get the hemoglobin and hematocrit once. But if you feel that the patient is not getting, syempre titignan mo naman siya, kung pale siya, symptoms, and or she's not getting enough nutrition from the diet, then you can repeat it at before the third trimester. So that's 28 weeks as she enters the third trimester to 32 weeks to detect significant anemia. So this is a sample of a pregnant woman's daily diet, but Ma'am Myrna later on in her lecture will be focusing on yung talagang particular sa diet natin. But if you notice, 5 servings of fresh fruits and vegetables, usually per cup yung serving, more of grains kasi, mas maganda yung grains kaysa sa talagang simple carbohydrates. Kasi may iron yan and then low glycemic index. Of course, still your milk, preferably low or non-fat. And then 2 to 3 servings of extra lean meat, chicken with those skin fish, or cooked or dried beans and peas, and hydrate well. So at least 8 glasses of water per day. In terms of fish, hindi rin maganda na parang isang would say na mas healthy kung fish lahat, instead of the chicken, may protein din naman doon. Better for fish, at least 2 to 3 servings lang per week. And then there are certain fishes that contain a high level of mercury, although hindi naman yun yung usual na kinakain natin. Mga swordfish, king of mackerel, hindi naman natin siya masyadong kinakain. So most of the fish that we eat naman sila high mercury content. But kung puro fish ang kinakain mo, baka mag-accumulate nga naman yung mercury. So dinidiscourage namin yun. Dapat moderate amounts of fish, 2 to 3 servings per week. Postpartum, so nearing the end of my lecture, some of the requirements are decreased, but some are increased. Like for example, vitamins A, D, E, C increased. Iron, surprisingly, decreased ang requirements during the postpartum period. But ang dito particular, kasi since the patient is breastfeeding, definitely increased ang caloric requirements. So 640 kilocalories per day. So maganda nga na mababa lang yung requirements ng iron during pregnancy, because this is a good time for the patient to restore the lost iron. Kasi if they're not restored after childbirth, pwede silang until babalik sa reproductive cycle nila, may negative effects. So ulit, fatigue, poor concentration, during breastfeeding, di ba, they can't sleep, mahirap na nga matulog, pagod sila. So kailangan, this is a good period for us to restore their iron. So we can give oral iron supplementation in the postpartum period. So the WHO says 6 to 8 weeks ng may daily tablet of iron, so that we can bring back the iron stores in the pre-pregnant state para okay yung concentration. So the common question is, should mothers take a multivitamin while breastfeeding? The answer there is pwede, maybe. So you can usually get it naman from the diet, no? Yun na naman, parang ganun yung during pregnancy, no? But some kasi restricted yung diet nila. And for those na, for example, vegan, o di kaya for some reason naka-keto diet, or talagang they're obese tapos naka-diet sila, then they're not getting enough nutrients from the diet, then pwede naman mag-multivitamin. Pero hindi siya hard and fast. Unlike during pregnancy that you have to take the iron and the folic acid. Yun. So breastfeeding mothers may benefit from taking a multivitamin supplement. So yeah, I think this is my last slide. Thank you very much for listening and take care.
Thank you so much, Doktora Sherri, for that comprehensive discussion. And marami siguro tayong matatanong dyan. I'm actually personally curious. So let's go to our next speaker. Our next speaker is Doktora Myrna Sedurante. She's a graduate of the UP College of Medicine class of 1989. She's an internist and endocrinologist, diabetologist. And aside from that, she has a master's in clinical epidemiology. Currently, she's a professor at the UP College of Medicine, and her hospitals as an active consultant are Manila Doctors and Capitol Medical Center. So let's call Doktora Myrna Buenaluz-Sedurante, Mu Sigma Phi Sorority Batch 1989. Doktora, okay na po ba kayo?
Yes, I'm okay. So I'm gonna share my screen now. Okay, so teka lang, wait. Okay, so let's jump right into it and talk about the perfect recipe for health. So thank you, Sherri, for putting in all the broad strokes. And now we want to translate it to ano ba talaga ang pwedeng kainin at hindi. So that's my goal. Okay, so here it is, the perfect diet. Let's talk about first what to eat and then how to eat. Okay, so we're gonna go through first nutrient-based diets and then dietary intervention-based diets. So una muna pag-usapan natin, ano ba yung magandang fats, carbohydrates, tsaka proteins, tapos ano ba yung mga diets, yung mga combinations that have proven to be effective. And we have there the Mediterranean, DASH, keto, and the WHO diet. And then we also wanna talk afterwards how to eat. Ano ba dapat? Intermittent fasting, modified alternate day fasting, time-restricted feeding, etc. Okay, so let's go first to the fat. So maybe the type of fat matters, and indeed it does. So we have three kinds of fats: the saturated fats, trans fats, and the unsaturated fats. So for the unsaturated fats, those are usually derived from plants and vegetables, as you can see there. And then the saturated fats are usually the animal fats, but I have another slide for that. So why does it matter what kind of fat? So here is just a study exposing animals to different kinds of fats. So here is the polyunsaturated fat and the monounsaturated and the saturated. So ito yung unsaturated, either mono or poly, and then ito yung saturated. So see here, ito yung blood vessel ng mga ng mga animals, and see yung laki ng plaque or bara dahil sa fats na kinakain ng individual, no? So makita natin, mahalaga pala si poly, maluwag. Si mono, pwede na, pero si saturated, wag. Okay, so here's the table that you wanna look at. So saturated fats, yun yung mga animal fats, usually mga mammals. Okay, mga pork at saka beef yan. Okay, tapos usually naman yung polyunsaturated, ang pwede lang dyan, poultry, no? Poultry. Kita mo dyan. Tapos meron pang poultry na unsaturated, tapos merong monounsaturated, but we'll go to that later. So again, let's look at this table. So we have the saturated fats, which are a no-no, and the unsaturated fats, for which there are two groups, the monounsaturated and the poly. So yung poly yung pinakamaganda. Tapos we can see this in the literature. Meron pa silang omega-3 at saka omega-6. Ano ba ibig sabihin nun? So sa polyunsaturated fats, we have two groups, the omega-3 fatty acids and the omega-6. Now usually, ang marami sa pagkain natin, tignan natin tong list, ay mga omega-6 kung meron man na polyunsaturated. And yung omega-3, yun yung unti lang. So ang goal is to increase the ratio of omega-3 to omega-6. So let's look at here, omega-3 sa polyunsaturated. Yung mga kakaibang klaseng isda. Okay, see there's salmon, mackerel, tapos sardines. So sabi, mahirap lang daw kumakain ng salmon tsaka mackerel, pero tama yata yun na lang dapat kainin kasi omega-3, no? And then for the omega-6, we have the poultry and then certain kinds of nuts. And then for the monounsaturated, okay pa rin. Ito yung naririnig natin. Yung palang olive oil, unsaturated siya, pero hindi siya talaga yung pinaka-best, no? Kasi pinaka-best itong polyunsaturated. Pero olive oil is monounsaturated, okay pa rin, basta unsaturated. Tapos here you get an idea na yung magagandang oils na pangluto natin, olive oil, sunflower oil, etc. So makikita natin ito, again, dun sa list, we have the omega-3, ito na talaga yung good fats. Ito naman omega-6, okay naman din, pero sana mas maraming omega-3. Monounsaturated, mas okay pa rin kesa sa saturated fats. Yung saturated fats, again, from mammals. Okay, so ngayon nakasulat dito, ano ba itong mga trans fats na naririnig natin? Well, noon kasi merong silang way na pag-modify ng mga cooking oil para mas tumagal siya. So tawag doon ay mga trans fats kasi hydrogenated yung mga cooking oil. Pero ngayon talagang for the phase out na ito kasi nakita nila marami pala tong hindi magandang effects. Okay, so that's the fats. So now, ito na ang listahan ng mga omega-6 at saka omega-3. So again, ito yung gusto natin, yung mga omega-3. Okay, so makikita natin dito, ito ang pinaka-the best kasi yung omega-3 to omega-6 ratio ay napakataas. Napakataas ng omega-3 and kakaunting omega-6. So eto na yung pinaka-the best salmon. Kain tayo niyan. Sardinas, mackerel, oysters. Okay. So ngayon ito naman yung sana wag naman masyado kasi makita naman natin na kahigit-higit yung mga omega-6 at konting-konti omega-3. So eto na si bacon, nandito na pala. Okay. Tapos ito, grabe din to, si pork chop. Ay, naku, gusto ko pa naman ng pork chop. Okay. Anyway, tapos sa mga nuts. Alam niyo, mamaya pag-usapan kayo Mediterranean diet and they really like you to have some nuts because the nuts have omega-3 and the number 1 nut is walnut. And then makita natin, wala naman tayong walnut. Macadamia nut o sa Hawaii lang ata yan si macadamia. Eto ang atin, cashew nuts. O diba? So cashew nuts na lang, wag masyado. Yung si peanuts nga, ito si peanuts ang taas ng ratio ng omega-6 to omega-3 so hindi siya okay. 770. Ano ba? 776 to 1. So si cashew napakaganda pala. Paganda pala 'yon. Okay. Okay, again, it's impossible to have something that has omega-3 only, but if the content of omega-3 is the higher compared to the omega-6, ayun ang maganda. Okay, so now, you wanna cook your food, you wanna use cooking oil, makita natin dito, ang gusto natin yung mas maraming yellow, purple, at saka blue. Pero kung mas maraming blue, yun ang pinaka-the best. Tapos, very little itong saturated fat. So makikita natin who are the winners or who's leading the pack. We have canola oil, safflower, and sunflower oil, flaxseed, and here naman the olive oil. Pero kung titignan mo naman yung pinaka-the best oil, polyunsaturated, nanalo naman si flaxseed, pero wala ata ito sa merkado natin. Ang meron is, ito si canola. Kaya actually, I tell my patients na canola oil. E tignan naman natin si olive oil. Si olive oil, marami namang monounsaturated, tsaka poly. Tsaka mababa naman din yung saturated fat. Okay? So, summarize, canola, olive, sunflower, safflower. Yan ang meron tayo. Okay. So now we're done with the fats. Again, do the polyunsaturated over the saturated fats. So, what about the carbohydrates? Ano naman sa carbohydrates? So, in the literature or in the popular media, you're hearing about glycemic index and then whole grain. These are the details about carbohydrates. So, ito lang papakita ko lang sa inyo tong Okinawa diet. Ito kasi yung mga taga-Okinawa, sila yung pinakamahabang longevity, no, compared to other populations. And ang kinakain nila ito, sweet potatoes, carbohydrate na yan, sweet potatoes. Ano ba yan? Kamote. So titignan natin yan, yung kamote, mababa ang kanyang glycemic index. So what is this glycemic index? The glycemic index is a scale that ranks the number of carbohydrates in foods from 0 to 100, indicating how quickly a food causes a person's blood sugar to rise. Okay, so halimbawa, kinain mo, mabilis tumaas ang blood sugar mo. Tawag doon high glycemic index. Pero kung halimbawa, kinain mo, ang tagal bago tumaas ang blood sugar pag mini-measure, tawag doon low glycemic index. So sa makatwid, ayaw kasi natin ng swings in blood sugar. So gusto natin may time na mag-secrete yung katawan natin ng insulin at emit yung pagkain. So that's where the low glycemic index foods come in. And in fact, napakahalaga nito sa mga diabetics kasi yung diabetics may delay sa pag-release ng kanilang insulin. That's part of their disease. So mas maganda sila low glycemic index. Ngayon, if you cook the food, process the food, and the riper the food, nako, mas mataas na yung glycemic index. And pag naglagay ka naman ng additional fiber sa food mo, kumain ka ng mga gulay kasama ng mga carbohydrate, di syempre, bumababa yung glycemic index kasi yung fiber nag-help na hindi agad ma-absorb yung mga food natin. So that's first concept, yung glycemic index, and here are the lists of low, medium, and high glycemic index. So ito na nga si kanin, short grain rice. Pa ito naman si brown rice. Okay, di ba? Pero talagang mananalo dito. Ito si sweet potato, si yam, kamote, tapos itong legumes. Kasi we can get carbohydrates talaga from vegetables. Kaya alam mo yung mga low carbohydrate diet, minsan ang ginagamit nilang pampuno, itong mga low glycemic index. So puro mga beans, soybeans, kidney beans, etc. And then kamote, and then in the in-between naman, have some brown rice na lang. Or potato, nandyan din. Sweet corn, nandyan din. Wag lang kasi dito, short grain rice. Okay. So ngayon, ito naman ang head-to-head ng brown rice at saka white rice. Makikita natin na halos pareho lang naman yung calories nila, pero yung glycemic index ni brown rice is 55 kasi mas high siya sa fiber. Kasi less processed siya kumpara sa white rice. So let's all try to move to brown rice. And because nga less processed siya, marami siya mga vitamina na naalis sa processing ng white rice. Take note. Okay, so ito naman ay just a table, a graph na nagsasabi na kapag mas marami kang white rice na kinain, itong open circles, ito yung Asian populations kasi tayo mahilig sa kanin. Samantalang itong blacked out, ito yung mga Caucasian population. So yung risk of diabetes, we're talking about the risk of diabetes, and the higher the graph, the higher the risk. So mas maraming kanin, mas malaking bilog. Ito naman, mas less yung kinain na kanin, kaya hindi na-attenuate din yung risk ng developing diabetes. Pero pag mas malaki ang mga bilog, ibig sabihin mas maraming white rice na kinain yan. So more at risk for type 2 diabetes. So ngayon, that's the glycemic index. No? Punta naman tayo sa whole grain. Ano ba kasi ang nangyayari dun sa processing ng food? Ang nangyayari, tignan natin to sa left-hand side, merong whole grain, tapos yung katabi niya, hindi na siya whole grain. So ano ba nangyari? Nung pinases yung food, nawala yung germ, at saka yung bran part nung grain na polish off. And because of that, nawala si fiber and nawala si vitamins. Okay, so now here's the list of the whole grain. Mga ito ay hindi natin kilala, ngunit ito si corn, whole grain siya. Tapos kung brown rice, whole grain din siya, wild rice. O kita niya, and here is another one, oat. So yun na nga mga sa atin. Itong mga iba, wala tayong mga rye, etc. etc. No? So again, what is it? It's corn, oats, wild rice, and brown rice. Yun ang mga whole grain. So merong vitamins and merong fiber. Okay, so we're done with the fat, we're done with the carbohydrate. Ano naman sa protein? Ano naman ang kukunin natin? So makikita natin yung white meat, mas less yung fats dun sa kanyang in-between ng mga muscles, no? So makikita natin yan sa poultry, but specifically chicken at chicken breast, okay? So fish, white meat. Ano yung red meat? O yung turkey pala talagang tunay na red meat. Tapos pag chicken na thigh, red meat na din siya. So pork, veal, and beef, all yan red meat. So kita natin, white meat is leaner, red meat naman has more iron, zinc, and B vitamins. So I guess ang ano nito is have a variety, but maybe you can lean more on the one, which is not to say you should not eat the other. But medyo yung ratio na yan, we have to take a look at that. Okay, so now another way of classifying yung protein na kinakain natin is high biologic value versus low biologic value. What does that mean? Yung high biologic value, kumpleto sa amino acids, samantalang yung low, hindi. So parang, lumalabas, kain na nga lang tayo ng karne, but then no. Kung medyo maglilin ka towards the vegetables, ang kailangan mo na lang gawin para hindi makuha mo lahat ng amino acids, kahit na low biologic value ang bawat isa, pag kinambine mo, edi magkakaroon na rin siya ng increased value. Kasi yung iba may certain amino acids, yung iba naman merong iba rin. Okay, so high biologic versus low biologic. Okay, so we talked about fat, carbohydrate, and protein. Ano naman kaya yung mga combo nun? Paano mo ba sila pagsasama-samahin? Yun yung tinatawag na dietary intervention-based diets. So, magpagsapan na natin ngayon yung mga specific diets, ano? So, we have, ito pinagsama ko sa isang slide, the Mediterranean diet. And ito naman yung DASH diet. Sa US na develop itong DASH diet. So yung Mediterranean diet tsaka DASH diet are the healthiest diets which really have decreased mortality and decreased cardiovascular outcomes. Now, if you look at them, well, hey, they kind of look the same dun sa bottom. So the bottom is the pyramid, yun yung mas kakainin mo, and yung nasa tip, yun yung medyo wag mong kainin. So ano ba yung similarities nila? Nagkapalit lang ng unti si grains at saka si vegetables. So si Mediterranean medyo may grain, mas nauna yung grain, tapos veggies and fruits, tapos legumes. Ito yung kanilang protein source, so ano yung legumes and beans. Samantalang dito naman kay DASH diet, nauna naman si vegetables and then grains. Tapos ang ano kasi nitong DASH diet, ang kanyang focus is low salt and low fat. Okay, yun ang kanyang talagang ano. So actually, bagamat meron kang pyramid, lahat ito pwede mong kainin, pero sa araw, sa araw-araw, except lang si sweets. Pero lang, paliit ng paliit habang pataas ka yung amount na pwede mong kainin. Samantalang tignan mo dito kay DASH. Sa araw-araw, ang pwede lang talaga ay si cheese, yogurt, olive oil, beans, veg, fruits, and grain, and si fish, poultry, sweets, nandun na sila sa a few times per week. Okay, so pareho silang may fruits and vegetables, that's a good thing. And then the big thing din with the Mediterranean diet is the olive oil. Okay, and then sa kanila, meron ding dairy products, no? Malaki ang emphasis nila medyo sa dairy products. So that's the Mediterranean diet. Again, yung mga karne-karne o kahit isda nga, not every day. Pero sa DASH meron basta walang salt at saka walang fat, lean. Dito hindi naman kinakailangan lean kasi hindi naman madalas. Okay. So now, the other, so yan yung mga dalawang diet. Ito naman yung usong-usong diet ngayon, yung ketogenic diet, kasi talagang mabilis ang pag-lose mo ng weight kapag naka-ketogenic diet. Ano ba itong ketogenic diet? Nabaliktad si pyramid. Ang fats napunta sa ilalim, protein kagitna, and yung carbohydrates, which is our main source of energy, ay nando sa taas. So what happens? Wala tayong energy source. Kaya yung mga na-ketogenic diet, masakit ang ulo nila kasi kulang yung blood sugar, medyo mababa. So ang ginagawa na lang ng katawan kapag walang nakikitang carbohydrate, nagsiswitch ito sa fats. Kaya tuloy nanghangayayat ang bilis ng weight loss sa ketogenic diet. Okay. A little bit more on that a little later. And ito naman yung, alam mo si World Health, gusto niya pagsamahin lahat itong mga diet na to and come up with its own recommendation na incorporates the best of all worlds. And see again, here, the fruit, vegetable, pinagsama lang niya yung dalawang ranks nung dalawang big time diets nandito. Tapos fish, pwede namang everyday, pero pwede ding mas maunti. Tapos nilagay niya sa ilalim ng pyramid yung physical activity na hindi na pag-usapan dito sa ibang diets. Okay, so now let's look at this one. These are the short and long-term outcomes. So ano ba yung mga diet diyan, Doktora? Saan ba mahahaba ang buhay ko dyan? So yung short-term outcome na gusto natin is itong weight change. So kitang-kita mo dito, pag mean weight change is ibig sabihin gaano bumaba ang iyong timbang. So makikita natin sa low carbohydrate, yung pala yung pinakamagandang pagbagsak ng timbang. Ano ba to? Kilo-kilo na ito. 6 kilos. So talagang in what? How many months ito? Mga as fast as 1 to 2 months. Ayan na. At 2 months, pwede ka na magkaroon ng 5 kilo weight loss with the low carbohydrate diet. Tapos yung Mediterranean diet, okay din. Actually, any diet for the first 2 months, okay, as long as you stick to it. And then the Mediterranean diet, in the end, nag-approximate naman ng low carbohydrate diet. Tapos yung low fat diet, hindi siya masyado. So ito actually yung DASH diet, low fat, low salt diet, no? So at the long term, nasa 3 kilo na lang. Samantalang itong si low carbohydrate diet, nasa medyo 5 kilo. Tatagal na, ilang months na, halos 2 taon na. But here's the downside for the low carbohydrate diets. This is a chart on the hazard ratio. That means gaano kalaki ang posibilidad na mangyari ito sa'yo. Ang mini-measure na hazard dito is mortality, all-cause mortality. So makikita natin, ito yung graph kapag ikaw ay kumikain ng high carbohydrate diet, low carbohydrate diet, tapos ito high carbohydrate diet. So, ang mortality nag-i-increase kapag ikaw ay, ang risk nag-i-increase kapag ikaw ay very low carbohydrate or high carbohydrate. And it is least kapag ikaw ay moderate carbohydrate, which means 50% of your food comes from carbohydrate. Okay, so madami, masama, konti, masama, pero tignan mo, yung konti ang mas delikado. So masasabi natin sa ngayon, sa mga studies na to, na si low carbohydrate diet, pwede siya short term for weight loss, but pagtagal-tagal, kailangan na tayo lumipat sa mas okay na diet. And maybe that will be the Mediterranean diet. Okay, so here is the WHO prescription of what is a healthy diet. So, nag-emphasize sila sa physical activity, tapos yung dietary practices that they should start early, tulad ng mga sinasabi ni Sherri kanina, yung parang preemptive, bago ka magbuntis, asikasuhin mo na yan. Okay, and then ito is important, energy intake should be balanced with energy expenditure. So makita natin dito si WHO, ayaw masyadong magbigay ng masyadong mabibigat na recommendations na kikiling from one diet to the other, no, always in moderation, parang yun ang sinasabi ni WHO. Okay, so now we talked about nutrient-based, we talked about dietary intervention-based. Let's go naman ito sa how to eat, maya-maya. But bago natin pag-usapan, inom muna tayo kasi kanina pa tayo kumakain. So about drinks, syempre gusto nyo naman malaman si kape. Dati kasi si kape, laging pinagbabawal. Yung pala biglang nalaman nila, kadami palang benepisyo ng pagkakape. So ngayon, ang laka na ng kita ng Starbucks dahil sa mga balitang ito. And let's look at it. So ito, magkape ka ba o wag? Yan ang unang tanong. So ito, ang 10 most, so hindi itong yung kape tayo, meron din naman palang medyo sana wag magkape. Ito yun, no? Ito yung 10 most harmful na nakita nilang outcomes from coffee. So siguro tignan mo to, kung meron ka nito o propensity for nito dahil sa family mo, family history, di baka hindi ka masyado si kape. Pero ito naman yung 10 most beneficial na benefits from coffee. Ito lang yung ang nito sa group na ito ng mga studies na to, ang tanong lang nagkakape ka pa or hindi. Okay. So ngayon, punta naman tayo sa, ito, kung mas tataasan mo yung kape mo kaysa konti, mas nakikita na natin dito yung 10 most beneficial, pumapasok na yung mga heart attack, pumapasok na yung diabetes. So I go in my slide yung yes or no coffee. Ito yung nauna ko slide. Kita mo dito, wala pa yung cardiovascular outcomes, no? Diba? Pero nung pinadami mo na yung kape, ayan na, nagkaroon ka na ng good outcomes na ito. MI or heart attack, type 2 diabetes, favors coffee na. So ano ba yung high coffee? 3 or 4 cups. Hanggang 4 cups lang, take note. Okay na yan. Konti lang naman siguro ang umiinom ng mas marami dyan. And meron pa dito yung mga some movement disorders and neurodegenerative. Okay din sa high coffee, 4. Okay. So ngayon, kung decaf, ito, yung ibig sabihin ng favors coffee, that's real coffee. Ibig sabihin ng no coffee, So, itong line na to, basta lumampas ka na, favors coffee ka na. Kapag dito ka naman, favors no coffee. So, makikita natin, halos wala nang benefits kapag unreal coffee. So, hindi talaga singhusay si decaffeinated coffee compared to real coffee. Okay? Okay. Ano naman, what about green tea? Ang uso naman ngayon is green tea. So, this is a busy slide, but just let me say na coffee man or green tea or tea, merong decreased cardiovascular mortality, total mortality, at saka decrease din ng mga ito, tingnan mo, dementia and Alzheimer's. Yung mga neurodegenerative diseases na particular na nabe-beneficyohan sa coffee. Pero yung green tea, ito kasi just tea, kahit anong tea. Pero yung green tea, meron din siya sa dementia and Alzheimer's. So actually ngayon, talagang ang push for green tea, talagang nandoon. So ito, tignan natin to. Sino ang nagbe-benefit sa coffee at saka sa tea? So, tignan natin ito ha. So, pag tignan natin itong slide na to, ano to ha? All-cause mortality. Okay. So, ito, makita natin, hazard ratio. Pag bumaba yung hazard ratio, mabuti yon. Pag tumaas yung hazard ratio, more than 1, hindi okay yon. So, ito yung 1. So, makikita natin sa women, ito, women, blue. Habang dumadami yung kape mo hanggang mga 4, makikita mo nagdi-decrease yung hazard ratio mo. Okay. Sa women. Sa men, pag nagkakape yung mga men, medyo bumababa yung hazard ratio pero hindi singhusay ng sa women. Kita nyo ba yun? Tapos sa men, kapag medyo lumampas na yung kape na medyo madami, talagang bumupunta na dun sa 1. Okay ngayon, what about yung tea? Makita natin, dito tayo sa tsaa. Hazard ratio, again, pag 1, wala siyang benefit. Pag bumababa yung ratio, bumubuti. So, tignan natin sa women. Mukhang kahit gano'ng parang karaming tsaa iniinom yung mga women, walang masyadong benefit sa kanila, no? Pero tignan mo sa men. Pag dumami pala yung kape ng men, hanggang mga 4 na tasa, nagdi-decrease pala yung hazard ratio sa men. So parang yung mga asawa nyo, mga kuya nyo, mga tatay nyo, painumin nyo sila ng tsaa. Sa babae, kung mahilig ka sa kape, stay ka na lang dyan kasi wala ka naman na masyadong nakuha sa tsaa. Okay, so ito, inumin naman kasi natin pareho. So sa women, wala masyado kapag walang masyadong pagbabago. Pero sa men, pag dinataasan nila yung tsaa nila, makikita natin, ito yung men, yung mga red. Pag tinataasan nila yung tsaa nila as a ratio of coffee hanggang tea, pag dumadami yung tsaa kaysa sa kape, bumababa yung hazard ratio. So in summary, yung tsaa na yan, mas okay sa lalaki yan. Tayo mga babae, kung gusto natin ng kape, ox na tayo. Okay, lastly, malapit na akong matapos. Probiotics, narinig natin to. Merong kilalang probiotics, starts with a Y, hindi ko na sasabihin. So anyway, kasi itong mga bacillus na to, itong mga good bacteria na to, what it does is that kung they break down yung kinakain mo into certain substance. Kinakain mo, binibreakdown niya into basic parts. Ngayon yung pag-breakdown nitong mga good bacilli, mas magaganda, mas nagiging maganda yung mga substrate as they break it down kasi maganda yung pagka-breakdown nila ng mga kinakain mo kumpara doon sa normal bacteria na nando sa tiyan natin kasi meron naman tayong mga bacteria talaga dyan. So in short, probiotics, the word is good. No? The data is good on the probiotics kaya makikita mo mataas din ang push for probiotics because yung substrates na i-absorb mo mas maganda, edi mas less diseases ang sinasabi nila for those who are on probiotics including diabetes, etc. I'm almost done. So I talked about nutrient-based diets and then dietary intervention-based diets with Mediterranean and then Dash leading the pack. And then how to eat. Alam mo kasi bawat isang tao, depende yan talaga. Pag sinasabi kasi nila, pag small frequent feedings, kung madalas ka kumain, pero unti-unti, every time nagkakain ka, nagbaburn ka din talaga ng calories with the digestion. Kaya yung iba, mas gusto nila small frequent feeding and iba, inire-recommend ito sa mga diabetics kasi konti lang yung insulin nila. So kung yung feeding nila, spinace out nila ng tigkakaunti, yung insulin ng body nila nagiging sapat sa bawat small meal na kinain nila. Ngayon, yung iba naman, kasi pagkain ka ng kain, wala ka na maalala kung di kumain, kaya mas maganda 3 square meals na lang. Ngayon, yung time-restricted feeding, sa long term, sa totoo lang, hindi din masyado yung weight loss. No, kaya lang medyo, so sa short term, pwede ka mag-lose ng weight, pero sa long term, nagplaplato na yung weight loss. Tapos, ang talagang may benefit ngayon, itong fasting. Lastly, merong iba-ibang klaseng fasting. Meron talagang merong alternate day fasting, yung hindi ka talaga kakain one day, tas kakain ka ad libitum o kahit anong gusto mo the next day. Meron namang moderate alternate fast. Yung moderate, 40% lang kakainin mo dun sa fasting day, tapos ad libitum the next day. Tapos yung susunod naman is yung time-restricted feeding, wala siyang masyadong benefit sa totoo lang. So, ang pinakamatunog is yung moderate, yung modified fasting. That is, kakain ka ngayon, 40% lang, tapos the next day, okay. So, mas nagiging okay yun, ano? Tsaka, syempre, yung alternate day, pwede din, kaya lang napakahirap, medyo mahirap na gawin. So, having said that, that's the end of my presentation, and I'm sure we're gonna have a lot of questions after this. So, lastly na lang pala, let me talk about yung pinag-uusapan ni Sherri, which is yung body mass index. Mas mataas yung body mass index, mas mataas yung mortality. So while the majority of my lecture, I talked about yung quality of food, but if we can really lose weight din talaga, mas haba talaga yung buhay natin. That's it. Back to you, Dr. York.
Hello, and thanks everyone. Thanks, ma'am, for that very interesting lecture. Ang ganda po, ano? So, ngayon naman po, let's go to our reactor. And our reactor po is Miss Reese Rayos. Reese is a graduate of marketing from De La Salle. And she also po has a very interesting her own food blog and social media. Ito po ang The Foodie Station. Yung pangalan pa lang ng blog, nagutom na po kami. Okay, so Miss Reese, are you ready?
Yes, yes, thank you, Miss Anna. So, hi everyone. So, thank you for inviting me today as your reactor. So, as a food blogger and of course, with the number of followers that I have, in a way, I need to be responsible din sa mga post ko, no? Kasi hindi din pwedeng basta kain na lang tayo ng kain without thinking kung ano yung mga possible consequences kapag nasobrahan or nakulangan tayo ng yung mga nutrition na kailangan natin sa body natin. So first things first, I'm so grateful that we have this kind of webinars available na for everyone to watch and participate at. Imagine before how hard it was for our mga kababayan na limited lang yung access nila to this kind of information. So at least at this point, on top of the traditional ways like, you know, sa school or when we go to our mga physical examination or when we go to meet our doctors, we have this way of knowing kung ano ba yung mga tamang kainin and you know what's right for our body. So thank you to Mu Sigma Phi Sorority for spearheading webinars such as this, and I'm looking forward to watch more and babalikan ko yung mga dating mga webinars natin dito. So I learned a lot as mentioned from this webinar. Nalaman ko pwede pala maging iron deficient kahit hindi ka anemic. And I bet kahit gano'ng kadalas natin marinig yung word na proper nutrition sa schools, sa parents natin, sa doctors, marami pa din talaga yung hindi nakakaalam what proper nutrition is. So, even me, technically, for as long as alam ko yung go, grow, glow, akala ko alam ko na eh. 'Di ba? Pero marami pala actually medyo medyo info overload nga, pero lahat to importante and kung pwede lang na magkaroon ako ng hawak na kodigo every time nakakain ako, I'll refer to everything na minention kanina ng mga speakers natin. So from types of the fat, the glycemic index, even the difference of drinking coffee and tea. Buti na lang mas coffee drinker po ako, no? Though I love tea also. So also of course, given that sa mga kababaihan that it's very important to know what food to eat, especially if we want to get pregnant, of course, at the end of the day. So thank you so much, Doktora Suplido and Doktora Sedurante. I learned a lot. So alam naman natin na mahirap, sabi nga kanina, alam naman natin to lahat. Medyo mahirap lang gawin and mag-control. Lalo na yung chicken with no skin. Sobrang, kasi ang sarap nun. Tsaka yung bacon and pork chop. Doktora Myrna, grabe. Ako rin, gustong-gusto ko yun. And yung mga followers ko, yan din yung sobrang number of likes for every time I do post it sa social media. So, very interesting talaga tong topic na to. Especially for me, as kanina I advise sila, mga panelists natin, I was actually obese before, and now I'm proud to say overweight na lang ako. Pero still, I'm still pushing hard para lang malaman kung ano yung tamang combination, tamang diet, and what's the right food to eat, no? Especially now nasa pandemic situation tayo. So, well, in relation to the first topic, it's very important for all the women here that we know the basics, especially now that hindi pwedeng naniniwala lang tayo sa mga fake news. Ang dami natin ngayong nakukuha mga fake news sa social media. So, hindi pwedeng nakikinig lang tayo sa mga sabi-sabi and haka-haka. So, we need to ensure that we are taking the advice of our the doctors. Everything should be backed by science, or else it will be detrimental to our health and the health of the babies na sinapupunan ng mga sises natin, di ba? And yung mga gustong mabuntis, syempre, kailangan dun tayo sa tama lang and sa totoo. So, in relation naman to the second topic, which is lahat talaga makaka-relate dun sa topic na ito kasi marami sa atin, lalo na nga naging work from home, so nawala na rin yung sense na parang hanggat may pagkain tayong nakikita sa ref or sa pagkainan, kain lang tayo ng kain kasi, di ba, parang nasa bahay, we want to be healthy, ang daming naglipa ng mga bagong food ngayon, di ba? So, we need to ensure that, kumbaga, make sure lang natin na yung kinakain natin is controlled, tama, nando tayo sa best combination. Pero syempre, we need to know ano ba talaga yung sustainable, ano nga yung best combination. So, thank you, Dr. Myrna. Sobra talagang marami akong natutunan doon kanina. So, siguro, ang kailangan lang talaga natin matutunan is that this is not just something for us to read, no? Kailangan natin itong gawin. And at the same time, we need to back it up with the right exercise, yung proper diet, of course. Kasi kung hindi, syempre, hindi naman enough na yun lang yung sa kinakain natin. So, actually, I have many questions na naisulat. Pero siguro, ang unahin ko na lang yung mga, lalo na yung mommy ko, syempre pagka-parents, ang daming mga sinasabi sa mga anak nila. So, nagagalit yan sa akin kasi lalo na yung nag-diet ako, sabi niya, hindi pwedeng hindi ako kumakain. So, ano po ba yung masasabi ninyo sa UMAD diet or yung 1 meal a day na diet? And hanggang kailan lang po ba natin pwedeng gawin ito? And ano rin po ba yung tinatawag natin, yung mga food supplements na binibenta sa merkado? Healthy po ba talaga to? Okay lang po ba itong i-take on top of the food that we're already taking? Kasi syempre, di ba, maraming binibenta ngayon dyan lalo na ngayon na pandemic na sinasabi nila mas makakatulong to sa health natin, something like that. So, that's just two of my questions. And then I for sure marami pang nakalista sa atin, no, Dr. Ana. So, well, basically that's it. Back to you, Dr. Ana.
Thanks, Miss Reese. Congratulations also on the foodie station. So sige, ay tackle po natin muna yung unang tanong ni Reese, which is the 1 meal a day diet. Siguro, Doktora Myrna, baka kayo po yun. Tell us about the 1 meal a day diet.
Okay, so let's talk about, so actually lumalabas itong 1 meal diet ay parang, kasi dalawa yung fasting na dalawa yung main categories niyan. Isa yung alternate day diet, mababasa mo yan, tsaka yung modified alternate diet. So yung alternate day, kakain ka ngayon, bukas hindi ka talaga kakain buong day. Tapos yung modified fast naman is kakain ka ngayon, bukas ang kakainin mo less than 40% ng kinakain mo kahapon. These are okay diets. In fact, we're talking about weight loss, talagang pwede siya, mangyayari siya sa alternate day, tsaka sa modified. So kung hindi mo talaga kaya yung alternate day, pwede ka naman sa modified, which is 40% of what you usually take the day before. Pero alam mo to, syempre itong mga diets na to, mga weight loss lang ang outcome. Kasi syempre, imposible namang may tao na makakagawa nito ng sobrang katagalan na matakita natin na mas humahaba ang buhay din sa ganito. Abay, bibihira, baka walang ganun. So short-term weight loss, you can do that which you mentioned, alternate day, or you can modified alternate or alternate. But then, ang mangyayari niyan, yung iba sumasakit ang tiyan. Kasi hindi na nakaka-counteract yung baseline acid production ng ating tiyan. So yung iba bibigay diyan. Hindi kakayanin.
Okay. So, matira ang matibay dito sa 1 meal a day diet.
Totoo yan.
Himatay mo dyan eh. Okay, po is, how about this over-the-counter supplements? Mako-comment nyo, Ma'am Myrna doon, Doktora.
Over-the-counter supplements, you mean?
Yung mga yung mga nakalagay na, yung binibili lang mo, mga food supplements, yung mga, may disclaimer po yan, di ba?
So the take on, so in short ako, ang iniinom ko lang talaga na food supplement is multivitamin. Okay, kasi bakit?
Okay.
Kakapasting ko, di syempre lahat ng mga sustansya na yan, hindi naman napapasok sa kinakain ko, di ba? Kasi hindi ko naman makakain lahat yung si prutas, si vegetables, tsaka si carbohydrates. So, dahil doon, kailangan ko na talaga mag-multivitamin, di ba? Yung basic na multivitamin. Yung complete, pero alam niyo na kung ano yun, ganon. Tapos, yung mga iba, meron din mga ibang supplement na shows promise but no approved therapeutic claim. Some of those would be coenzyme Q, so some of those are melatonin. Okay. So, ano yan? Kung may extra money ka, okay lang. Hindi yan makakasama sa'yo, pero hindi sure na makakabuti. Okay. Okay. So, tapos meron pa yung ibang vitamin na merong kakaibang mga dinagdag. I have to say the name, no? Kasi yung sana, meron sila nilalagay ng mga resveratrol. Yung resveratrol, example, yun yung sa wine. So meron silang mga proven na, kasi wine talaga may benefit, di ba? Ang ginawa nila yung nasa wine, nilagay nila sa vitamin nila. Pag binasa mo yun, marami silang mga ganon na ipinasok doon na okay din talaga. So kung medyo may pagka-high-end, pwede din. But the basic is the multivitamin. Yun lang.
Okay. Ayan. Thanks, Doktora Myrna. Ito, Ma'am Sherri. Is it okay for pregnant women to just take whatever food supplements are being sold on the market? Lalo na kung buntis ka, should there be a caution?
Generally, like Ma'am Myrna, no? So I mentioned earlier na generally you can get the RDA from your diet except for 3. So that would be iron, iodine. Pero yung iodine pwede sa fortified so hindi naman necessary sa and folic acid. So pwedeng yun lang naman talaga yung kailangan. But syempre, the pregnant, minsan we give the whole na lang yung marami na sila in one multivitamin. Kasi, di ba picky eater din si buntis? Kasi naglilihi, tayo konti lang kumain, lalo na in the first trimester. So it's alright. Yun lang with caution, actually, while Ma'am Myrna was saying, may naalala ko na patients namin sa high-risk clinic, sometimes yung mga herbal, ayoko na sabihin yung mga brand, no? Yung mga herbal with antioxidant, na parang pag pinakinggan mo, and a lot of people use it, okay lang, parang okay lang, di ba? But meron din kaming konti lang naman, no? And na-concur ko din to with some of the internists. Tumataas yung liver enzymes at saka meron kami na nag-RTA, nag-renal tubular acidosis. Tapos nung na-investigate, dahil dun sa supplement na tinitake. Kaya ko yung mga pakita mo muna sa akin, kasi binabasa ko na lang muna. Kasi nga, meron talaga na merong increase in liver enzymes and pati renal function. O nag-RTA pa yung isang high-risk patient namin. Tapos sabi nung renal service dahil dun sa supplement. Parang kaya medyo after that very careful na ako. Lalo na yung mga hindi mo kilala, hindi mainstream. That's it po.
Thank you. So basically, don't just take anything, and just because it's expensive doesn't mean it's good. And just because it's natural doesn't also mean it's good. I really want to say that. Doktora Sherri, ito lang medyo iba yung tanong ko.
Yes,
May mga OB akong kilala who are pushing certain vitamins. Yun pala, nalaman ng pamangkin ko, MLM member pala at Diamond si OB. Allowed ba yun?
Ma'am, brand? Maglagay ng brand? Or dispensing? Paano ba ma'am? Dispensing in the clinic?
Yes, MLMs. I don't want to mention brands, but basically sasabihin nila na mas maganda yun. Parang yun.
Ma'am, actually, ako pharmacist.
I don't know. I mean,
so, ma'am, meron ka
dahil mahal, ganon, maganda.
Yes, ma'am, not necessarily. So, meron kasi tayong Regenerics Act, no? Actually, hindi ka pwede maglagay ng brand talaga technically, no? So, that's a law. And then, on the dispensing din, ma'am, meron din tayong medical act on that na the physician should not dispense. Ang pwede lang mag-dispense is the pharmacist. So they can, the physician will prescribe and then the pharmacist will dispense. Yun po. Merong mga sa ibang countries, parang merong kung in-approve ng FDA, tsaka parang may some agreement or something like that. Pero sa atin, ang alam
Not
ko,
allowed.
follow the Pharmacy Act and the Medical Act. Opo, ma'am.
So thanks, Doktora Sherri. Do not buy your vitamins from the OB, okay? Para lang maging Diamond member siya. Okay.
Na yun, ma'am.
Ma'am, Myrna. Don't.
Interest. Opo.
Okay, don't do that. Okay. Ma'am Myrna, parang short po kayo.
Doktora Ana, medyo choppy. Paulit.
Opo. Ma'am, intermittent fasting. Tell us something about yung hinahao. Yung and then
Intermittent fasting.
Intermittent fasting po.
Let's talk about intermittent fasting. What happens here is that you are eating for only 6 to 8 hours per day. So meron ka lang window na pwede kang kumain. And usually ang nito is hindi mo kailangang piliin basta kumain ka sa oras na ito. No, pero kasi bakit? Ano ba nangyayari? Kasi kapag matagal kang hindi kumain, yung tiyan mo lumiliit. I mean, hindi siya masyadong distended. And because of that, mabilis ka mabusog pag kumain ka na. So pag nangyari yon, inevitably, mas unti na ang makakain mo kasi hindi lang konti ang oras para kumain sapagkat ang lalagyan ay nasanay na sa konting pagkain. So yon ang tinatawag na intermittent fasting. 8 hours ka lang pwede kumain. Okay, actually ako, I do that and I find that it works. You know, ang mahalaga kasi dito, you have to find out what works for you. No? Kung bawat isang pasyente, iba yan. So kailangan matuntun kung ano ang mabuti para sa kanya. But, weight loss benefit, hindi din masyado sa mga studies. 1 or 2 kilos, that's it. Okay? Back to you.
Thank you, Ma'am Myrna. So we have a question here po from the audience naman. COVID diet, yung mga nagre-recover po sa bahay at hindi daw makapunta sa grocery, anong dapat nilang kainin? Siguro yung natira sa bahay, yun ang dapat yung kainin or pag-grocery muna. But ma'am, the COVID diet.
There is no specific diet in the literature for post-COVID patients. Talagang wala eh. Kasi siguro, alam mo, that's an avenue now that you talked about it for research, but they haven't done, and I haven't seen any papers on it. You know, so walang ano. So it's just a balanced diet.
Okay. Meron pong audience question uli dito. Ano daw mas maganda, brown rice or quinoa or adlai rice? And can we know the benefits of quinoa kasi sobra daw pong kamahal?
So kung makikita na maalala natin yung pinakita kong slide kanina, these are the whole grain. Basta kasi hindi pinalish kaya naiwan yung germ at saka yung parang pinaka-shell niya. And so that is the fiber and the vitamins. And the fiber, with the fiber kasi bumababa yung ating bad cholesterol. Okay, so these quinoa are talagang, and aside from that, these are the low glycemic diet grains. So, but then the brown rice is kind of, if you look at my, those are the low glycemic whole grain. Samantalang brown rice is moderate glycemic whole grain. Yan. Eh, kung maraming pera, di pwede din. Pero kung pwede na si brown rice, pwede na.
May black rice pa nga, di ba, Doktor Camille?
Pareho lang din siya, high fiber.
Huwag nyo na lang pong, yeah. So, high fiber. Thanks, Ma'am Myrna. Giling. Okay. Doktora Sherri, bakit po nahihirapan magbuntis mga matataba? Tinamaan po ako dito because nakakayamang sabihin, I'm overweight. Ayan. So galit po yung mga matataba sa sinabi niyo or na-hurt, Ma'am Sherri.
Ay, sorry ma'am, I didn't catch that question, ma'am. What if you are?
Yung ano po, why is obesity, why do they need to lose weight?
Oy, opo. Yun, I had a slide there on the many risks, no? So una, kung hindi, kaya nga sabi ko, di ba, pinupush talaga namin yung preconceptional care. Kaysa sa, actually prenatal care, that's the, talaga hallmark. Pero ngayon, na-learn natin na mas maganda, bago pa magbuntis, no, na assess na natin yung patient. So for example, obese siya, kailangan talaga natin, kailangan natin to lose weight and try to attain yung normal, yung slide nga na pinakita ko kanina, yung normal parang 24.9, pero yung Asia Pacific, di ba Ma'am Myrna, mas mababa pa doon. Mas maano yung threshold, 22, more than 22.9, di ka na normal range. So parang, kasi pagka ikaw ay obese, so una, I mentioned, may studies na yung obesity, yung obesity, una, mahirapan ka mag-pregnant kasi more or less, most likely may menstrual irregularities and hormonal imbalances ka. Let's say, kahit na obese ka at nabuntis ka, swerte, dasal mo ng maayos, you got pregnant, during pregnancy, pwedeng turbulent yung pregnancy because the risk for hypertension is there, gestational, no? Gestational hypertension, not necessarily na yung hypertensive ka before. Pregnancy-induced hypertension, gestational diabetes, it's there. So, dun pa lang, you're putting your pregnancy and the baby at risk. So, ang dami congenital defects. Ang worst is stillbirth. Even fluctuations in the blood sugar or fluctuations in the blood pressure can have many adverse perinatal outcomes. Tapos, let's say, kahit obese ka, pero nabantayan ka, high risk pregnancy, nabantayan, okay pa din, nanganak ka ng, na CS ka. Kasi nga, laki-laki ng baby mo. Or for some, medyo maliit yung baby, hirap mag-thrive, so na-CS ka pa din. Pero okay pa din. Kahit na parang maganda yung outcome or fair yung outcome, may pa din, mayroong long-term consequences on the offspring. So, pag matanda na si offspring, maiinis na yung child nyo kasi sila may at risk sila for many cardiovascular events or dyslipidemia. So, kaya isipin niyo yung ano yung ano niya, yung benefit na kung medyo tiniis-tiis lang natin yung mga candies and sweets prior to pregnancy, malaki talaga yung benefit for the baby at pagtanda niya. So we really push for attaining sana a very normal BMI prior. Hindi yung pag naano ko dun sa iba na nung buntis saka pa nag-diet, parang dapat ka hindi eh. Di ba? Well balanced ka nga during, gusto mo pa mag-keto during pregnancy. Hindi pwede, di ba? So dapat prior. Ayun po, ma'am.
Okay, thanks, Doktora. And Miss Reese will answer our last question po. Will ask our last question. Miss Reese, go.
Yes, opo. For Doktora Sherri, so question lang po, if meron condition like PCOS or myoma or yung laging nagdidysmenorrhea, ano po naman yung mga food na kailangan naman i-avoid? Especially kung ayaw natin maging hindrance yun if gusto pang maging pregnant or something like that.
Yeah. So there are studies na correlating yung gynecologic disease and diet, no? So dati parang hindi, no? Dati parang magda-diet ka lang kung hypertensive ka, diabetic, tapos kung myoma, yun, you mentioned PCOS, but yung sugar kasi and the calories, para siyang insult sa cell eh. Or parang it aggravates, no? Parang in fact, and this is a favorite I will mention, Doktora Gigi Martinez. She always lectures on this. Maganda yung mga lectures niya on for gynecologic disease, para kasi there's a form of inflammation for any disease naman. So including yan myoma, endometriosis, yung mga may dysmenorrhea, polycystic ovarian syndrome. So if you fix your diet, especially yung sugar, yung calories, it aids in the treatment. Parang siya, complementary to the treatment. So apart from, syempre hindi naman ibig sabihin na pag nag-diet ako gagaling yung myoma ko. Hindi. Parang, of course, there's a medical or surgical treatment for that, but mas madali, it will decrease the inflammation, decrease the insult to the cell if you eat food na tama. So that would be more of lowering the high calorie. Ma'am gives a better explanation than me, but yon, kaya very particular na tayo ngayon. So marami ng even polycystic ovarian syndrome particularly, meron siyang effect on insulin resistance kasama sa pathophysiology. But even myoma, di ba, pag isip mo, bukol naman yun, na naman ang kinalaman. Pero yes, no, it decreases the inflammatory process and the insult to the normal cell. Kaya better yung parang lesser ka na dependent on the medication. Kaya yung weight loss din particularly. So weight loss, lahat na yun. So parang kaya very helpful siya for many gynecologic diseases. Kaya tama to have the proper diet and to lose weight.
Ayan. Thanks, Doktora Sherri. And now we've come to the end of our very interesting 1.5 hours. We will ask our speakers po to wrap up 1 to 2 statements lang po of what you want to remember. Yung talagang tumatak po dapat. Okay, Doktora Myrna, kayo po, if you're okay, kayo po ang mauna.
Okay,
and then Doktora Sherri.
Okay, let's go. So first of all, we emphasize the importance of really going down on your weight. So if you're obese, become overweight. If you're overweight, become normal. And then aside from that, everything in moderation, and mix all the good things together to have a better outcome. How about you, Sherri?
Ayan.
Myrna.
Thank you so much. Doktora Sherri, ikaw na.
Yeah, so medyo similar din kay ma'am, no? So but I'd like to parang focus din kasi si ma'am yung more of the non-pregnant. For those who want to get pregnant and who are pregnant. So yun pa din. So pinupush namin the preconceptional care. So you have to if you want a good outcome, if you want to have good chances of getting pregnant and to have a good outcome for your pregnancy, visit your OBGYN earlier 6 months to a year, so that yun nga, the weight gain or weight loss, kung ano man ang kailangan gawin sa'yo. Kung normal yung weight mo, di very good ka, okay ka na magbuntis. Yun. And then she can screen you, and then like ma'am said, no, everything in moderation. We can counsel you on the diet, especially how to live healthy. And then, kapag successful na yung pregnancy, meron din tayo mga susundan na patterns and nutritional requirements during pregnancy. Para, ang always naman the goal is, if you're a reproductive age woman and you want to get pregnant, of course, a healthy outcome for the mother and the baby. Thank you po.
Ayan. Thanks, Doktora. And Miss Reese, one statement po what you pick up talaga.
Ako, ang masasabi ko lang is that health is wealth talaga. So, and of course, ano lang ba yung pinaka-accessible sa ating lahat? Syempre yung food, diba? So, kung alam natin kung paano i-take in ito ng tama, dito pa lang kaya nating mabuhay ng mas matagal and mas healthy, of course.
Ayan. Thank you so much, Reese. We'd like to thank Doktora Sherri Suplido, Doktora Myrna Buenaluz-Sedurante, and Miss Reese Rayos for our super interesting talk po today. And we would like to start our webinar. Salamat po. But before we end, magpasalamat po muna tayo. So the MU webinar team of the Mu Sigma Phi Medical Sorority would like to express a big thank you to our partners, the UP College of Medicine, at the Philippine General. And of course, kasama din po natin at hindi po tayo matutuloy without them in Life Sheroes and the Mu Sigma Phi Foundation. By the way, our official media partner is Our Awesome Planet. Salamat na salamat din po to the unwavering support of the UP Manila Information Management Systems and the UP Manila Postgraduate Institute of Medicine. And most of all, thank you everyone at nakasama po natin kayo ngayong araw na to. So, stay safe and stay healthy. So, konting paalala na lang po. For those who would like to get CPD units, please fill out the evaluation form at tinywurld.com/newwebinars2021/eval 50 days after the forum. You can find the links in the evaluation forms at the comment boxes of the FB Live, the YouTube, and the chat box po of Zoom. We'd also like to invite you for the next po, that's next month, mula kay Doktora, Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum, February 8 po ito, Tuesday at 12. Tara na, gumalaw, magsaya't sumayaw, which will discuss the ideal exercise regimen for the pregnant and non-pregnant and kung paano po ito ma-incorporate into our daily habits. So yan na lang po, and thank you so much for joining us, and magandang hapon po sa inyong lahat.
Thank you for attending the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum.
The MU webinar team of the Mu Sigma Phi Medical Sorority would like to thank our partners, the UP College of Medicine, Philippine General Hospital, and City of Manila. Again, the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum is co-presented by the In Life Sheroes and the Mu Sigma Phi Foundation.
And this event is covered by our official media partner, Our Awesome Planet. We are also grateful to the UP Manila Information Management Systems and UP Manila Postgraduate Institute of Medicine. Most of all, we thank you, our participants, for spending your lunch hour with us. For those who are interested in obtaining CPD units, please fill out the evaluation form at tinywurl.com/MUwebinars2021eval. Please ensure that your answers are submitted within 3 days after the webinar.
We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram. For more details and updates, please check our Facebook page at facebook.com/MUwebinars and our Twitter timeline at twitter.com/MUwebinars. You may also email us at mewebinars2122@gmail.com. Before we end, we would like to invite you to the next leg of the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum, on February 8, 2022, Tuesday, from 12 to 1 p.m., entitled All About Exercise, Let's Move, or Tara na't Gumalaw, Magsaya't Sumayaw, which will introduce us on the importance of exercise to good health and the ideal exercise regimen for pregnant and non-pregnant individuals. The speakers will be Dr. Faye Cagayan and Ms. Kathy Bersola, and to be moderated by Dr. Anna York Bondoc. And likewise, we would like to invite you to participate in our year-long Women's Health Forum series. Thank you very much for attending this webinar. Have a
Okay.
good day.
Okay.